Bob, good to have you on the programme tonight. Thank you very much for joining us. Let's just start with the more factual basis of this, if we could. How much disruption are these strikes causing within the health service? Good evening to you.
Evening. Yeah, so there is emergency cover. The consultants are covering the junior doctors that are on strike for emergency work. I suppose the disruption is caused mostly for elective care. Your framing seems to be demonizing the junior doctors, but let's just remind ourselves who's in charge and
Mm-hmm.
who's allowed this situation to develop.
Mm-hmm.
It's the government. We've had over a decade of pay contraction, such that
Mm-hmm.
junior doctors have lost a third of their income if it had kept up with inflation. Even before the pandemic, the waiting lists were growing to 5 million.
Mm-hmm.
A big reason behind the vote to strike, and it's not just the union leaders, it's the membership who are overwhelmingly voting to strike, is they
They
can
don't choose the
see.
dates, though, do they, Doctor? Just jump in there. It's not. It's the leadership that chooses the dates. It's the leadership that's chosen to plan this strike to coincide with the very
Well,
busiest
yeah,
period of the year.
if you're going to withdraw your labor, you do it at the maximum impact. There's no point having any strike action
But
where it
impact on
doesn't have
whom?
impact,
Impact on whom, sir?
political impact on the government.
But it's not.
Because,
It's not having an impact on them with respect. It's just to jump in there. It's having a
all
bigger
right, well,
impact on patients, isn't it?
please, if you let me make my point
Go on.
and come back, right? So you have a government that has a decade of defunding, that had no end of money to throw at the response of the pandemic, which was money down the drain, 27 billion, may I remind
Mm-hmm.
you. At the drop of a hat, they dropped any charges of investigating pandemic relief related fraud, which amounted to 4 billion. The cost of settling this dispute was around in the order of 2 billion. The bailout of the banks in 2008 was of the order of 600 billion.
Yeah.
So the government have taken a political decision to allow the strikes to continue because they're not making any realistic offer to make up for the pay theft that the junior doctors have suffered over the past decade. And junior doctors are striking because they can see their colleagues leaving medicine, leaving the country, and there's a massive shortfall of staff. So the NHS, even when there is no strike action, is endemically unsafe. We have tens of thousands of people waiting in overcrowded A&Es every day. This doesn't get reported. They're waiting in A&Es on a daily basis, and for every 80 patient waiting in an overcrowded A&E after the decision to admit them has been made for more than 12 hours,
Mm-hmm.
there is one preventable death.
But
So we are letting the government get away with their
but
shutting down of beds, the squeezing of salaries, the erosion of staff morale, and yet we have all this focus on the junior doctors and somehow blaming them for what has been a deliberate
so but
political
who
policy.
who nobody's blaming them for the state of the NHS. The only people I can see making that argument are, of course, Doctor, the government, and they would say that. I don't think people buy it. The state of the
Well,
NHS right now is the fault of the
you know,
government.
your framing seemed to be blaming it to me. I've tried to listen to it very objectively, but it seemed to be framing
But
enough's enough. The junior doctors must
yeah,
return to work.
yeah,
That
no,
seems to be
no, I didn't
framing
say
it as
that.
blaming the
Hold
doctors.
on, hold on. I said they should be able to continue to strike. I don't think withdrawing emergency care, and I don't think striking for 9 days during the busiest period of the year, which, as you say, is explicitly designed to cause most threat to patients. That's literally what the incentive.
No,
That's what the
I didn't
motive.
say I
You said
didn't say
most
threat to
disruption.
patient. If you would don't mind putting words in my mouth, I said disruption. I didn't say threat to patients, right?
But what
The,
if
the
dis?
consultants aren't going on strike, the nurses aren't going on strike. If they'd coordinated their activity, then that is really ratcheting up the ante. What they're doing
But they
is
did. They did that
responsibly
too.
making sure there's emergency cover and withdrawing
Sorry,
their
that's
labor.
not true. They're not making sure there's emergency cover, and they did coordinate with the consultants. So both those things have happened.
Right. So you're telling me there's all A&Es are shut on strike
Some
days.
are. Cheltenham's already closed. Cheltenham A&E's had to close because of this strike. People who have a heart
Okay.
attack in Cheltenham right now or soon can't go to A&E in Cheltenham because of that.
Okay. And do you not remember? People have very short memories. Can you not remember that every winter hospitals go on black alerts because there aren't enough beds
It's
in the
not, Doctor.
hospital?
It's not either
People are
or, is it?
queuing.
It's not
People
either
are
or.
queuing up in the backs of ambulances,
Yes.
dying in the backs of
Yes.
ambulances because of the staffing crisis, which
Yes.
has resulted from the wage theft and wage suppression by government. Now, you're asking people who are still in the NHS who are suffering, working in unbearable
Hmm.
circumstances, in understaffed, dangerous
Hmm.
environments, 24 hours a day, 7 days a week, to not withdraw their
I'm
labor as
not.
a
No,
last
sorry. Now
resort. That
you're
is
putting words in my
unthinkable.
mouth, doctor. I've said repeatedly. I've said three times already. The doctors
Yeah.
should be able to continue to strike. I'm not saying they shouldn't strike at all. I'm saying the way they are going about it, their specific
So
tactics at the
they
moment,
so
I
they
think
need
are
to consult with
indefensible.
you as to their timing of their
No, they
strikes,
don't
do
need
they?
to consult with me, but I am free to say that withdrawing your labour at the busiest time of the year, when knowingly that is going to lead to people losing their lives who wouldn't otherwise, to me is indefensible.
Well, let me throw in a new bit of information I think your audience might be interested in. On Monday of this week, Parliament introduced what is called a statutory instrument, which is a legal tool
Hmm.
to change the Medical Act, which will redefine the role of the General Medical Council to get them to regulate non-doctors. So what the government is trying to do is actually dilute the skill mix of the NHS and replace doctors with non-doctors. So they're saying a somebody who can study medicine for 2 years is the equivalent of a GP who's had to study for 10 years to get to that position. So you have to be aware of the political objectives of this government. And to be honest, the opposition aren't much better. They are actively removing doctors out of
Hmm.
healthcare and dumbing down provision. They
But
are not interested in patient safety. They're quite happy for the waiting list to go, which trashes the reputation of the NHS and drives more people into the private sector.
Doctor, you're not going to find any dissent from me about the Tories handling the NHS in recent years. I've said several
Sure.
times the handling of this strike and other issues within the NHS by the government has been woeful. But it's not either or. You can hold the government responsible for the situation in the NHS. You can demand they do something about it, while also saying that in raising the problems that you're talking about in a very legitimate way, the
Yeah.
specific tactics that the BMA is using to raise that point and make that point have gone too far. That's my point.
Okay, well, you frame it as woeful, and that suggests to me some element of incompetence. What I'm suggesting to you, there is not incompetence. There's an element of deliberate forethought to create a crisis, and behind which they can blame the doctors for the problems, whilst they're pushing through a political
Hmm.
agenda, which is to totally transform the NHS. It's already happened in law. So the NHS now in England has been split up into 42 new legal entities, which are public-private partnerships called integrated care systems. But there's next to zero public awareness of what's actually gone on. The NHS has been totally mutated into something ready for corporate takeover. And
Okay.
how this helps government is to keep the wages down, keep the wage packet and the wage bill down, as more and more control is transferred to private corporations, often foreign private corporations.
But again, Doctor, we can accept that the significant responsibility for the problems in the
Mm.
NHS lies with the government. I think most people would accept that, while also saying that the additional problems, the additional deaths that come specifically from those strikes, are also open to criticism.
Well, I put it to you, the additional deaths that are occurring every day when there is not strike action
Yes,
because of overcrowded
are the
A&Es,
fault of the
lack of
government.
beds in the hospital,
Are the fault of the
are
government.
being ignored while we focus and
But
try
then,
to
sorry,
misframe any
that's
extra
just not
deaths on
true.
the staff.
There
That's
is,
what's happening.
you open any newspaper on any day, you turn on the radio on pretty much any day. We've done it endlessly on LBC, discussing the state of the NHS, talking to people within the NHS, covering all the issues you're talking about. It's just not true
Yeah.
to say it's been ignored. It hasn't.
Well, I follow quite closely what is being reported. I'm not hearing any root cause analysis of the problem, right? It's the square blame lies on government policy, successive government policy of privatization, deliberately eroding the number of beds and the staff numbers such that a crisis is created to damage public faith. And as the brown stuff hits the fan, scapegoat the staff and scapegoat patients. That is what this government is up to. And unfortunately, some of the framing is playing into that agenda.
How do these strikes change or resolve any of the issues that you've just listed, Doctor?
Well, what other proposal do you have then? Do you expect people to be paid less and less for worse and worse terms and conditions and working in horrendous situations in understaffed wards without adequate beds, without adequate equipment? Is that what you expect, just to keep quiet and put up
No,
with it?
I expect doctors, when they are begged by charities to at least staff emergency care and the most crucial life-threatening service, life-saving services, to say,
Yes.
okay, the patients aren't the problem here.
So where are
Causing
these?
people to die to make a political point is not acceptable.
Well, I'm happy to hear your proof about how strike action is leading to death, but
But it's
you
not my
mentioned
words. It's
charities.
hospital bosses that are saying this. I'm not saying it.
Okay, are these the same hospital bosses that are pushing through the privatization by any chance? Are these the same charities that remain mute about the chronic understaffing and
So
dangerous
the
conditions?
likes of Age UK are just making it up, are they?
I'm not saying they're making it up.
But they're
They
what? They're
are,
vested
they are,
interests?
well, let me make my point.
Go on.
They are dependent on government for their charitable
Oh, come
status,
on.
which gives them a very big tax
Come
advantage.
on.
And let's not forget what the government did. They banned charities from taking any political stance in a year in the run up to an election. Now, if that is not trying to exert political control, then what is?
So you think the likes of Age UK are basically just pushing government agendas?
Absolutely. Where are Age UK talking about the privatization of the NHS? I've not heard it. Where are Age UK talking about elderly people languishing in corridors and dying preventably in the
Of
back of
course they are.
ambulances? I haven't heard
Well, I
it.
have.
They've been rolled out when it's convenient to back the government narrative, but they don't have a leg to stand on because
Rolled
they've
out
got
by whom?
whoever's asking for their comment. They are reliable mouthpieces to provide cover for government.
Got to leave it there, Doctor. Really appreciate your time tonight. Thank you very much for coming on the programme. That's Dr. Bob Gill, NHS GP, based in South East London and producer of the documentary The Great NHS Heist.